Welcome to Balanced Care Conversations with Equilibrio Home Health, the podcast that bridges the gap between innovative healthcare technology and compassionate home care. In each episode, we dive deep into the transformative world of healthcare solutions, exploring everything from physical therapy to the latest developments in skilled home healthcare. Join us as we engage with industry experts, healthcare professionals, and technology pioneers who are reshaping the future of home-based care. Whether you're a healthcare provider, caregiver, or someone passionate about advancing healthcare solutions, this podcast delivers valuable insights, practical strategies, and inspiring discussions that help create more balanced, effective care environments. Subscribe now on Spotify, Apple Podcasts, Amazon Music, or your favorite podcast platform to stay at the forefront of healthcare innovation.
Let's get started with the foundation story. So Mikelle, Heather, who are with us, can you take us back to the beginning? What sparked the idea to create Hampton Roads Professionals Reaching Out for Seniors? And how did, this come together with your shared vision?
Well, for us, I think a lot of it revolved around COVID lockdown, Tara. We were really wanting to be creative in how we connected with others. And plus, it was really, really good to see other people. So truly, it was as simple as Mikelle and I and one other senior care professional getting together, having cocktails outside and saying, this was wonderful, this was fun, let's do it again. Next time, we each invited somebody else, and it grew from 3 to 8 the next month. And from there, it kept on multiplying. So right now, we are averaging about 45 to as high as 65 participants per month.
Mikelle, what's your perspective on that?
Yeah, I mean, Heather hit it nail on the head. A lot of it came out of, organically. With COVID happening, I think our first HR pros, it wasn't HR pros at the time because the name did eventually come later, but our first meeting, if you will, was organic. Both of us out of the first meeting just wanting to, get out, because with COVID and most of the marketing and sales, networking, senior living individuals were not allowed to go into the communities. So we had to find a more creative way to reach out to each other. And so having something outside where restaurants had outdoors is was a good fit, and it began coming into a happy hour, social hour, because having a social hour or a happy hour makes it a little less formal, and it's after hours where people have the time to meet. But again, organically, Heather and I were like, well, you bring 5 people that you know, and I'll bring 5 different people that you know, and then we'll see where it goes. So as we had a couple of those, and then a lot of people were like, we need to keep doing this. This is great. People loved the interaction. They loved the connections that came out of it.
Like-minded people.
Exactly, with the same vision that we all serve seniors, and healthcare was hurting. People really wanted to make a difference, and it's just the natural feeling of human connection as well, that just naturally developed, and then out of that, relationships built and collaborative efforts just naturally fall into place. So
I think I always say that nobody outside of the healthcare and senior, service world understands what we go through. And so coming together as a way of unwinding with people who go through the same things as you on a day to day, with helping people, because when you help people, you're giving your whole heart. So it's like,
Yes.
unless you're in it and doing it, you can't understand. When you go home to your spouse, to your loved one, to your kids, they can't understand. So having that group to unwind with,
Yes.
this, going through the same things as you, and then going home instead of bringing it all with you.
Right.
But to be on a fly on the wall when we were talking names, though, I wish I could remember some of the names that we had. We came up with
Oh,
some very interesting names
yes.
back
We
then.
Some
had
of the
some that
names.
were We had some that maybe were a little PG-13.
Yes.
But at the end of the day, as Mikelle and I, thought about and brainstormed about the names, it had to represent the area first and foremost. We did
Right.
not want to be strictly Virginia Beach or strictly Chesapeake or Norfolk. So it was really, really important for us to incorporate Hampton Roads. And then, of course, with the pros, it was a great acronym that stands for Professionals Reaching Out for Seniors. And I, in that name, we're incorporating all the different types of professionals, of course, that are impacting the lives of seniors. This is not just kept to healthcare professionals. We're talking about realtors,
Yep.
elder law attorneys, financial planners, people involved in the insurance world.
Pet
And you
groomers.
could go,
Pet groomers.
yeah, pet groomers, yes. And so it goes so much further than just healthcare providers, though that tends to be the bulk of our participants. And we are professionals at what we do. We are experts in our fields. So to relate that feeling in just the simple name of Hampton Roads Pros, typically called HR Pros, people are able to learn a lot about us in the simplicity of that name, of professionals reaching out for seniors. But there were some PG-13 ones, that's for sure.
So
Some
to
good
touch
ones
on
thrown out.
So to touch on that, going into the next question, which we've kind of dived into a little bit, says like, so each of you do bring a very unique, expertise to the table. So when exactly do you think it switched from kind of like, where we're just networking, you're bringing people together, you're unwinding from COVID, to have an aha moment of saying like, you realize that this is something, this is can be something bigger than just like-minded people coming together, and
Yes.
it really went off. So where do you feel like that really happened for the two of you? Mikelle, do you want to go with that?
Sure. I think Heather and I have very similar like-minded feelings about serving seniors. Our backgrounds are unique. I come from a social work background as well as an administrative healthcare administration background, whereas Heather can speak to her background. But I think we were both leaders in the community. We've both served on the Virginia Beach Task Force on Aging. And I think that we naturally kind of took a step back and said, wow, this is really something that's making a difference. We have to keep this going. So, as we began to develop more relationships, our group of individuals that kept coming back every month kind of develop into friendships outside of work, and you could begin to see that we needed, as the interest grew, and we were starting to get more interest in sponsorships even for the food and venues, because as we grew, the need for space also grew, and the costs involved in having these types of networking events grew interest in sponsorships from various businesses to pay for the catering and so forth, which also brought more marketing to those companies. So it's not only just getting together, getting to know each other, and building those relationships. It offers a marketing aspect as well to businesses, whether they be large or small. Um, So there's benefits for everyone, but I do love the idea that, it has grown over time, and that we now have a pretty stable ambassador group, that, as we call them now, so that we can make these events happen successfully each month.
So my next favorite section of these questions, and it's probably the biggest love that I think came from this group, in my opinion, is how we collaborate, but with our own competition. And that it's not competition, that we have found, again, it's one of our biggest, we say it all the time, play nice in the sandbox. There's enough for everyone.
Yes.
The senior population, we're hitting, the boomer age, like there's a lot, and there needs to be more of us who have the right mindset. So going into that, that's kind of where we're at. Like, you have members who could technically be considered well, not members, but I mean, I guess, because I mean, we don't do memberships. That's a thing, right?
Participants.
Attendees.
Attendees, yes, who are all in the same room, sharing information and working towards the common goal. How do you navigate that? Or, how has that maybe changed the way, at least healthcare in our area does things, the impact that HR Pros has had with that occurring on a regular basis? You have a hospice rep who is sponsoring, but you still have other hospice companies who come to support those who are
Yes.
sponsoring. So it's like, you're still there. There's no shaming. There's no negative. Sorry.
So if I can answer the first part of that, and I'm happy to hand that back over also to you and Heather. But that question comes up frequently, even in the beginning, it was like, oh, well, that's Mikelle's group or that's Heather's group. It's not about who's running it. It's about the common goal, the
The
mission that we
intention.
have. Yes. So everyone is welcome. It doesn't matter who you are, who you serve, which company you are. If there's already a hospice, we welcome everyone. I feel like we all offer unique, different ways of delivery of care, service. Having a freedom of choice to be able to provide to clients is always a great way to serve the community. And not every company is different. I mean, not every company is the same. We're all uniquely different, um, just like every human being. So it may not be the best fit for this, or it could be an insurance issue. There's a lot of market share out there to serve in Hampton Roads. So having more connections to me is better. Um, Heather, you want to?
Yeah, I love what you said, Mikelle. And when I came into this industry, I was brand new to Virginia Beach, and I remember feeling like the different competitors, which we'll use that term, were like silos.
Mm-hmm.
We didn't they didn't want to share information. There wasn't that collaborative approach. And what ended up happening were people weren't maybe as knowledgeable as they are now about what the other options are, because, like Mikkel said, we all may be doing similar things, but at the same time, we are all different as well. And I know from my own family's perspective, I went through this with my own family for 8 years. It takes a village,
Mm-hmm.
and so the beauty with Hampton Roads, the Hampton Roads Pros is that these professionals are coming together, and though they may be speaking with other competitors doing similar things, they are walking away so much more knowledgeable about what the options are. And in that, they're able to help seniors more. Because if my assisted living is full,
Yes.
I can confidently refer to, say, Mikelle, who is a local senior advisor. If I know that they would benefit from home health in the home, I know I can say, please reach out to Tara at Equilibrio and make those connections, because when we don't do that, you leave seniors floundering and their families
Yes.
floundering.
Yes.
I also feel like my other favorite thing, and I'll do it all the time, especially for new people, because you'll see the new people show up and it's just like, oh, hey, who are you? And who are you with? And you can tell they're just kind of standing off. Everyone who does know each other's and, oh, I haven't seen you in forever. We only do this once a month. It needs to be more often, like all the people who know each other. So you can see the new people and they'll say, oh, I'm financial. Which they're like, so I know that's not really, and I'm like, no. Actually, you need to talk to all the private care people in here because
Yes.
they're all money. So I'm like
Yes.
grabbing Suzanne, like, come over here. You talk to this person because you're going to be who helps the
That's
family
right.
gets private care services because they need to balance their money. So planning here is here. Like, oh, you deal with funeral homes. You should connect to this hospice person over here because you guys are going to need to talk to each other to help families. And it's like, bringing people together and that face to face that you wouldn't necessarily have anywhere else. I
100%.
just, you know,
100%. I mean, another perfect example of that is the one that we had at Beach Vodka recently. Hospice House had sponsored that event, and there was a filmmaker that showed up. And would never have thought that, a filmmaker would show up at, Hampton Roads professionals reaching out for seniors. Well, my son is an aspiring filmmaker. So when I met him, I was like, oh my goodness, I need to talk to you. But not only for that reason, but for this reason, you need to meet this person. So you never know who's going to enter the door or who may have been referred to our group randomly because they heard about us through another professional who said, you need to go. This is a great group. So
I've
it's
had
really,
florists. I'm like seniors like flowers. Funeral homes. Like I'm like this
yes,
is all anything. If you think on it, honestly, we try to separate it. It's saying seniors as a separate community, but they're just people. People
right.
need things.
Yes.
So
Yes, it's
anything that could be a
really
Well,
service.
crazy.
and
It's really
I
crazy.
even think of the personal chef that came.
Yes.
A personal chef, or like Mikelle had said earlier, the dog grooming or the doggy hospice. I mean, again, we would not traditionally think about that as a senior care provider, yet they're serving our seniors in very important ways that are out of the normal box that a lot of the other groups may find themselves in. So it's really opened the door to a lot of wonderful collaboration.
Yes, it really has.
Okay, so to kind of step from, talking about, HR pros a little bit, but not so much, because of the fact that we are specifically more so, it's HR pros reaching out for seniors. I mean, it's Hampton Roads reaching out for seniors. What would you, Mikelle, say, or between the two of you, would think are some of the most pressing challenges that seniors face right now?
For me,
Um,
I'll go first, Mikkel. I see Mikkel thinking. So I'm
yes.
gonna go. I'm gonna go ahead and share what I think are the biggest challenges for seniors in this area and across the nation. Seniors are an invisible population. Um, they are, whether they're in a community, a nursing home, their own home. The reality, as we age, our mobility can change, our ability to drive can change. We're less able to advocate for ourselves. So it requires sometimes families, professionals, doctors to maybe be that voice to speak for seniors and advocate for them, because it truly is very often an invisible population. People may not see the seniors that are struggling in their homes. It was my own family was struggling in their own home, and it was invisible to us because they hid it so well. So that to me is what I feel is the biggest challenge for seniors in the area is invisibility, until there's groups like Hampton Roads Pros, and some of the other wonderful groups in the area as well. Don't get me wrong, but that ability to highlight seniors and reach out to them is life altering for seniors.
I would say that's a reason why, HR pros reason why. Go on, Mikelle.
Yeah, I just want to piggyback off of that a little bit. My mom just recently moved into a senior living community, and it's been a whole different perspective, coming from a professional working in the business over 25 years to being a caregiver. And I've advised many, many caregivers over the years, and stepping into this role. And I think the challenge, one of the challenges that I'm going to mention is, the lack of education around planning ahead, understanding that Medicare doesn't cover everything. If you need senior care, you need to plan ahead. I just got off the phone with a gentleman who is in a pickle. His mom is in an assisted living, and he's paid 2 months worth of uh, his own money to keep her there because he's waiting for Medicaid to approve her to go into a nursing home. Now, someone advised him very poorly during this process. And if they only would have educated him sooner, he probably wouldn't be in this situation. So I think the challenges are around just preparation and education, educating our entire community of not only the seniors but the adult children now that are stepping into this role. I mean, my mom was very fortunate that I was in a position to kind of prepare her in advance as much as I could, but a lot of families don't have that advantage. So I think we as professionals, are doing our best to do as much outreach as we can and educate our community. So I think that's a big challenge, is the lack of understanding and planning ahead.
Yeah, I agree with that wholeheartedly, Mikkel. Families and myself included, we felt like deers caught in the headlights.
Hmm. Yeah.
Even with all the information, even with the
Mm.
information, we know it is still a hard thing to go through. To kind of circle back, and we've touched on a lot of these questions out of out of order. I'm like looking, I'm like, oh yeah, we've talked about that already. We've actually already touched on that. But it goes into talking about what changes do you feel like you've seen since Hampton Roads Professional Reaching Out for Seniors organization, networking group. What kind of changes do you feel like it has truly made in our senior community world since we've gotten it all started?
This is our fourth year. I think we just hit June 22nd, 2021 was our first HR Pros. I feel like personally, based on some of the feedback I've received from the the individuals who frequently come back every month or on a regular basis, that we're stronger for it as a senior community of professionals. I feel like, even if it's, I don't know, I can't even put a percentage on it, but, the surveys that we've received have been, and the feedback is, oh, this is such a great group. I feel so comfortable here. I feel like I could call on someone. I just feel like we're stronger for it professionally, and in that respect, I think it trickles down to how we're able to better serve our seniors and their families along the way, because we're equipped and stronger for that. Because even though we may be there informally, socially, we still do talk business, and we sometimes talk personal because we may have something going on in our own lives that we need some help and support in. But I feel like it just adds to the strength behind the mission.
I kind of think I just want to say a little bit that it helped establish trust. What
Mm.
we talked about early on, that everybody was to themselves, separate, us coming together and sharing stories of our days, our hardships with each other, going, oh, you too? I even remember the first year I started Equilibrio and numbers were down and I'm freaking out. And then I talked to some other people and they're like, oh yeah, it's real hard right now. It's real hard. This is the time of year, and going, oh wow. So we're all going through this. We're all numbers are dipping right now. This is normal, not make stress on myself. Like I had been beating myself up over
Yes.
it. So trusting. And then, so at first, people don't like to say they're not doing well. But
Right.
the moment someone does it for you, then you admit it, and then other people, oh yeah, me too, and then me
Yeah.
too, and then you have a collection where we're all together, like, okay, let's grab a drink because we are all
Yeah.
struggling right now. um, but I think that it really created that dynamic of trust with each
Mhm.
other. I mean, the first time I think I even had another home health company that was like, hey, we're maxed out. Can you take this patient? And I'm like, oh, wow. Like, people say they're going to do that.
Yes.
But until it happens and you go, wow. And that's what I always tell people. I'm like, thanking people is the best way when you advocate for their company in return,
100%.
and
Hmm.
all companies go through hardships, so we do have to be cautious at times, but I always give respect to every person that if you see a company go through a hardship and then you see the change, that they're willing to make changes, they own up to it, then I'm always here for second and third and fourth chances as long as they're willing to put the work in to make a difference. And I think that's another thing you can see through getting together like that, because you'll hear, or they'll be honest, oh yeah, we've had to make some cuts, we've had to make some changes, I know you've heard, I know, and we're like, yeah, no worries, like we're still here, we're still going, you're still trying to do. And the more we got together like that, and it's talking and communicating, I don't know, I just feel like that's a big thing that changed
I
for
agree with you on
everyone.
the trust. Absolutely.
Mhm.
100%.
Well, and if you think about being able to share, if you're not doing as well as you were the month before, 6 months before, the reality is we want to help each other.
Hmm.
We're here for our seniors, but we also want to help and support each other. And most recently, HR Pros was involved in a really exciting event that I'll let Mikelle talk a little bit about, which was our small business big impact summer bash. It's our first annual one. But Mikelle, will you share a little bit about how we were able to highlight small businesses here in this area?
And nonprofits and all the big
Yes.
That's right.
nonprofits.
Yeah. So being a small business owner myself, and then of course, we as ambassadors, we meet once a month to plan events for our professional group. Oftentimes it's the little guy that you really want to see achieve big things. And so, as a small business owner, sometimes the costs involved with sponsorships and venues and things like that may have to be a shared co sponsored situation. Or, one business owner may feel better, knowing that they're just there, but the whole premise and the vision behind the small business big impact was really shining the spotlight on the small businesses. And when you we sat down at the table at a restaurant and we're like, okay, we need to come up with a list of small businesses, and going down the list, it was incredible because how many small businesses actually make up the attendees that come to our events. And there were over 30 that we could come up with at that moment. And we felt like, well, we need to make this affordable. And we want to also make sure that we're giving back to the community, which is where the whole big impact side of the small business big impact came from, is how can we do that? And so we asked those who wanted to participate to at least give a $50 contribution to a charity of their choice. And we came up with 9 to 10 um, charities, small business. 501(c)(3) companies or organizations, excuse me, in the area that we frequently love to support. And it was a big hit. I think we raised almost $1,500.
All the
And
nonprofits didn't they all go, they were all some in some way gave back to seniors in the community, right?
correct, yeah.
Yes.
So, Hospice House being one, the Alzheimer's Association, Parkinson's, Tidewater Arts Outreach. I'm sure I'm missing a few, but I apologize for not remembering all of them. But this
Off the
particular
top of
moment,
your
but
head,
I
how
think
dare
all
you?
Jewish Family
equally.
Services was
Oh
one of
yeah,
them
Jewish
as well.
Family Catholic Charities. Yeah, all very well deserving organizations were able to be there. Also, have a table, bring awareness. Each small business who made a donation uh, was able to have their small business table there, and anyone who came and enjoyed the event
We had
at
so many people.
we did. We had a great turnout at Acclaim of Greenbrier in Chesapeake. Very grateful for their space that they allowed us to be there. It really was a successful event, and we look forward to doing it again next year.
Yes. Yes, it was so amazing. I definitely think I also love the part that we allowed the small businesses to choose the
Mhm.
nonprofit that they wanted to donate to, because I do feel like a lot of organizations will make the decision for the group. Like they collect the money and then it's going to wherever they choose it to go. So I just thought that was an added very nice touch that we allowed them to choose who their heart wanted to give to. And you never know when somebody's been touched by something, whether or not they've had a family member with Alzheimer's or Parkinson's, or at some point, Catholic Charities helps them out with a situation. So it's just like, I really love that direct.
Yes, it was awesome. We were just
And
blown away about how much great positivity that came out of that, but also I think the small business organizations felt heard and seen and valued. It was really great.
Okay, so I would just a bit of some wrapping up. Like I said, we touched on a lot of things. We could probably do this all day. This would be like a
we
3 hour
could.
segment if we
Yes,
really wanted
we
to.
really could.
But what are y'all's thoughts for the future of HR pros?
I mean, we'll do it as long as people come.
Amen to that, Mikelle. Yep. And I think what's been nice is HR Pros continues to evolve.
Yes.
It's evolved from its conception. It will continue to evolve, but at the heart of it is, a group of people who love seniors, and that will never change.
Love
Uh,
helping people. Love
yep,
helping people.
and helping people. So I think what I envision is we will continue to grow. We will be and I think we already are, a integral, interwoven part of the Hampton Roads professionals and healthcare network, specifically for seniors. But I think the word about Hampton Roads Pros has spread beyond anybody that beyond just the people we're touching, and so I
We have
think.
people who come from Richmond and Williamsburg
Yeah,
to our events.
absolutely. I've had people fly in, people have flown in their, regional directors,
Oh yes.
CEOs, owners, that
Yes.
have come in from other areas. So, I mean, uh, who knows? We know that there have been other people that have been interested in branching off, Hampton Roads pros to their own areas. We've respectfully asked that remain here in Hampton Roads, as the Hampton Roads pros. But I think Mikkel and I also want people, if they're in other areas, or even in this area, if they feel compelled to start a group, by all means,
Absolutely.
all it can do is help. But we're really proud of what we've created here, and we know it'll continue to grow.
I definitely, I'm always saying connecting is how we help people. The more people we connect with, the more people we can help. That's just what it is. So if more people create connecting groups, then, and they're genuinely doing it to help each other and to help others, then so like please by all means. I mean, but I do just want to throw out there on a side note that it is like the one and only time a month that I go out and actually enjoy myself. So I will
Me
push
too.
its continuation just for that reason. It's the only time.
Yeah, we try to keep it consistent every like third or fourth Wednesday or Thursday of the month. Not that may not work for somebody. So if there is another group that, is a better fit or, better fit for their schedule, more power to them. I support any group that, certainly wants to develop, like you said, the more attention and support and collaboration we can offer each other, the better the benefit to the
Yeah.
seniors.
Yeah. I think, yeah, whenever you're an inspiration to others, you're doing a good thing.
Yes.
Yeah.
For sure. I definitely agree with that. My big thing that happened from HR pros is, I always say that I don't like to tell people I don't know something or I can't figure something out. And so when I have a family who's like, do you know of a funeral home or do you know of a financial person? I have over 5,000 numbers in my phone. It's like for every person we connect with at HR pros, it becomes I'm instead of a family having to spend hours cold calling
Mm-hmm.
from the web from the website, from whatever list some hospital gave them. Of course that's also going to happen.
Mm-hmm.
That's
Well,
also
just
going to
think about
happen.
all the times that we've gotten cards and we have our group texts, right?
Yep.
And did anybody have that person's card? They were wearing this, blah 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 blah, and we're like, "Yep, here we go, here it is." If we didn't work as a team, or if you have another colleague friend that attended the event who may have grabbed a card that you may have missed or misplaced. I mean, there's always someone that you can call upon, or we encourage anyone within the group who may not have a contact person that they remember meeting, but they maybe misplaced their contact information. We're happy to share that information, just so you can
especially
get
people
connected to help somebody. So.
especially people getting started, because that's
Mhm.
that's my big thing. Without Heather, she dragged me in. She was like, come do things. Yes, you did. And I ignored her at first. She was like, why did you miss the last task force? Because that was the other thing that she first started it with. It was like, you better be here, you better do these things. And she was my person who kind of, so that's why I do it for every new person I meet. I'm like, every time I meet a new person, I'm paying forward what Heather did
Yes.
for me. I'm like, I'm paying it forward. I'm paying it
Good.
forward.
Yeah.
Well, and thanks for sharing that, Tara, because, again, this is very fulfilling to all
Mhm.
of us too. We walk away really happy to know that we're helping make these connections that have these great outcomes for professionals and for seniors, and just to share off of that, Tara, it was really meaningful at this most recent HR Pros for Celeste Wooden, who, is now, is she a director, administrator of, a home health company but she's doing amazing things,
Yes.
absolutely amazing things. And, she thanked me for inviting her when she was a CNA, because again, it takes all of us. And
Mhm.
again, spread the word, invite all the people. We
Yeah,
need them all.
everyone is welcome. We're always saying that.
Yes.
Everyone
Yes.
is welcome.
Yes. And we can all make an impact.
I love you both so much.
Oh,
Oh,
it's so
well,
good
so
to
thank
see you
you.
all.
Thank you so much for having us on the podcast.
Thanks for tuning in to Balanced Care Conversations with Equilibrio Home Health. If you found value in today's discussion, be sure to catch our next episode on Spotify, Apple Podcast, or wherever you get your favorite podcast. For more innovative healthcare insights, detailed resources, and the latest in skilled home healthcare technology, visit us at equilibriohh.com. Until next time, keep striving for balanced, innovative care solutions that make a difference. Remember, the future of healthcare starts at home.